If you are planning for knee replacement surgery, then 5 most commonly asked questions we are going to discuss today. Number 1 question is, how long is the surgery duration? So normally, if you are planning for knee replacement, the surgery for one knee takes less than 1 hour. So for both knee, the operative time is around 2 hours or less. But when we shift the patient from room to operation theater, there are a lot of steps involved, like waiting in the preoperative area, giving anesthesia, scrubbing, painting, draping, putting a catheter, and then post-op recovery. So normally it takes 4 to 5 hours for patient to come back to the room after the surgery. Though the surgery is only of 1 hour or maximum 2 hours, depending on the complexity of the knee replacement, but overall the surgical time period from going from room and coming back to the room is around 4 to 5 hours. Second most commonly asked question is about the suture removal. Suture removal normally happens between 14 to 18 days. Normally when we discharge the patient, before that we do one dressing of the patient, then again the patient is called for next dressing after 5 days, and after 1 week or so we remove the sutures finally. Third most commonly asked question is number of days in the hospital. So if you are doing for one knee, normally patient needs to stay in hospital for 3 days. If you are doing for both the knee, then the normal stay is between 4 to 5 days. Fourth commonly asked question is about the pain. So basically when we talk about pain, the patient asks about how uncomfortable he or she would be regarding the pain. So now the good news here is normally the type of technique available these days, we are able to kill almost 80% of the pain. The patient, we make the patient very comfortable from first day onwards, because we use a special type of catheter in the spine that reduces the pain by almost 80%. That is why patient is very comfortable after surgery these days, and sooner, almost within 3 to 4 days, we shift the patient on oral medicines also, and patient is comfortable before discharge as well as after discharge at home. Fifth most commonly asked question is about returning back to normal life. Now, returning back to normal life is normally like within the first 2 weeks, patient requires a walker for mobilization. Around second week, the patient is able to leave the walker, and he or she is able to carry out all daily activities without walkers support within the home. And by 4th week, most of the patients are comfortable in carrying out daily activities, going out for a walk, and also climbing stairs. So if you are planning for knee replacement, don't worry, it's a very safe and effective procedure. And if you have more doubts or any other query you want to raise, then you are most welcome to contact us on our given number or on social media. Thank you.